y'all. Kayla Mowdy, Doctor of Physical Therapy here for another Monday educational moment. Today I want to talk about car accidents, specifically ones where no serious injuries occur but you have pain. So after impact of a car accident, no matter what the angle is, if there were no broken bones, nothing that you had to stay over the night in the hospital for, you thought you were okay, adrenaline was pumping, you check around, no blood, no nothing, you're okay, but then the next day you feel like you got hit by a train. So what to do in this case? I see a lot of patients after car accident. I prefer to get them into the clinic by like the 2-week mark. If you're still having pain 2 weeks after a car accident, please go see a physical therapist. A lot of doctors will do x-rays over and over again, and they'll give you muscle relaxers and say it's just a muscle strain. But please go see a physical therapist in this case and get some specific things to work on to get you moving again. But in that 2-week period, my advice is drink lots of water, keep moving, do your normal routine, do your normal pattern, and include deep breathing. So fluids and oxygen are two very important components of the healing process. So if you do have that muscle strain, that achy, that wherever it's going on, whatever the nature of the accident is, wherever you're hurting, oxygen and water can help you heal. Our bodies are amazing and they will heal, but those two things are needed. So no sodas, no junk, good stuff in to get good stuff out. And then the component of the keep moving. So the purpose of this is the more you sit around, the more you lay around, the more you rest, which the muscle relaxers, if you are given those, they can make you tired and make you rest more. Those things are generally not recommended because your body needs to move, and if those muscles are not moving, no matter how much you're drinking water and how much deep breathing you're doing, the oxygen is not going to get to the area that it needs to get to. So movement is medicine, and then water and oxygen help too. So if you've been in an accident, I hope this never happens to you, but if you have been, please drink lots of water, take lots of deep breaths, keep moving, and at that 2-week mark, if you're still having pain, please go see a physical therapist and get some specific things to help you feel better faster. Bye, y'all.